Senator Kaine.
Thank you, Mr. Chair. Dr. Monarez, it was good to visit in the office about public health data modernization, a priority we share. Your written testimony interested me because when a witness prepares testimony and chooses to bold 2 lines, that tells me that these are the really important lines in the testimony. And the 2 lines that you bolded in your testimony were, good public health saves lives, and when public health is neglected, it costs lives. Those are the 2 bolded lines. Is smoking a public health issue?
It is.
And is ignoring smoking as a public health issue run risk to people's lives?
Smoking prevention and mitigation is a very important public health strategy to mitigate the risk associated with tobacco use and cancer.
Thank you for that. Mr. Chair, I'd like to introduce in the record an article from Stat News from April 14, quote, why CDC cuts are being called the greatest gift to tobacco industry in the last half century.
Without objection.
The article points out that on April 1st, the CDC's Office on Smoking and Health was eliminated. There were 120 full-time employees. They were all laid off. Contractors into the office had been all laid off in February. If smoking is a public health issue and ignoring it is a public health challenge that could risk lives, how can we justify the complete elimination of the CDC Office on Smoking and Health?
As you know, I was not by law involved in any of the personnel decision making.
Can I actually don't know that. So let's focus on that. You were at the CDC from January till March 24th. Mm-hmm. All of the and you were the deputy director and then acting director. Mm-hmm. All of the contractors who do work with this really important office that have been around for decades were all laid off in February when you were in that position. And the employees were all laid off on April 1. So let me just ask you, did you have anything to do with the decisions about eliminating all the contractors and then all the employees in the Office on Smoking and Health?
I am not aware of the layoffs to the contractors.
Okay, now let me just, did you, so the answer is you did not have anything to do with the layoffs to the contractors, if you're not aware.
I am not aware.
Did you have anything to do with the layoff of all the employees of the office?
I had no participation in the personnel decision-making after I left.
Right, but so you were not involved in any discussions about laying off the entire office before you left on March 24th?
So I'll tell you what I was involved in. So we were given clear guidance from the secretary.
But I only want to know about the Office on Smoking and Health, so don't talk to me about anything else. Were you involved in any discussions about laying off the entire staff of the Office of Smoking and Health before you left on March 24?
So when we were given the tasking to return CDC to its core functions related to preventing, detecting, and responding to infectious diseases and emerging threats, I worked with the career staff there to make sure that we did both made sure that we were reinforcing those core mission areas.
And in those discussions, did the Office on Smoking and Health, was that office discussed?
I don't recall that specific office, but...
okay, well, if you don't recall the specific office, then I'm going to go to a next question. Just, you're a career public health professional. I mean, if public health saves lives, and this is an office that's been going for decades that's shown real effectiveness in reducing smoking, isn't it a bad idea to completely shutter the Office on Smoking and Health and lay off all the employees and contractors?
Look, these issues are still public health priorities. And
for who?
They're public health priorities for the secretary, they're public health...
Okay, public health priorities for the secretary. The article that I introduced in the record also points out that he's laid off almost all the smoking expertise at the FDA. So give me any evidence that this is a public health priority for the secretary.
So this is a public health priority for the secretary.
Tell me one thing he's done. You have laid off the entire office at the CDC.
So
all of the contractors, all of the employees. You've gutted the FDA. Let me read really quickly. The end of OSH comes along dramatic changes at the FDA, including the elimination of the center's management and regulation divisions and the ouster of top tobacco regulator Brian Kling and head scientist Matthew Farrelly. You didn't have anything to do with the FDA, you're not there, but Give me one thing that this secretary has done that would suggest he understands what you testified to, that smoking's a public health issue.
So the secretary has continued to support preventing chronic disease.
Okay, is smoking-related disease a chronic disease?
Cancer related to tobacco use can turn into a chronic
Yeah, because it's what Senator Houston said, the things we put in our bodies. That's a chronic disease. It would seem like that would be something that would be a priority for the HHS secretary, and yet the CDC, complete elimination of this office, and the FDA, dramatic curtailment of its office. I really have questions about, not about the statement that you made in your testimony, nor about your qualifications. I've got questions about your willingness to follow through on your values. I yield.